Good evening to all the warriors who win the battle of cancer. My today's topic is um, about the head and neck cancer. Um, the journey through treatment and beyond the head and neck cancer. Head and neck cancer is a term used to describe a group of cancers that start in the in the mouth, throat, voice box, nose, sinuses, or salivary glands. Um, these areas are vital for basic daily functions such as breathing, speaking, eating, and swallowing. So, when cancer develops there, it affects more every part of the person's life because he or she is not able to swallow peacefully, not able to enjoy the food, and many other things. The experience of living with head and neck cancer from diagnosis through treatment and into survivorship is not only a medical journey but also a deep personal and emotional one. The talk explores what life is like during treatment and how survivors cope with emotional, social, psychological, and physical challenges that comes afterwards the treatment and during the treatment. So first of all, we are going to talk about the lifestyle during the treatment. A new daily routine. Suddenly there is a new a big change in life. Then they came to know that they are suffering from the cancer, and so their whole routine change, like very different from the previous routine and the present routine after detecting the cancer. So, the new daily routine, once treatment begins, life changes dramatically. Most patients undergo a combination of surgery, radiation therapy, chemotherapy. These treatments can last for weeks or months or require regular hospital visits, scan, and consultations. The routine revolves around medical care, early morning at the clinic, long waiting times, and often periods of rest due to fatigue. Patients must adjust their schedules around treatment sessions. Many have to take leave from their work or reduce their daily responsibilities. Family members often step in as caregivers, helping with transportation, meal preparation, and emotional support. Very important. So there are their routine completely changed after that. Diet is very important part of the whole lifestyle. So head and neck cancer treatments often affect the mouth, throat, swallowing muscles. As a result, eating becomes more difficult, um, or painful, you can say that. Some people lose their sense of taste while others develop mouth sores during radiation or chemotherapy, or dry mouth uh, due to radiation. So nutrition becomes a crucial part of care. Dietitians usually recommend soft foods, smoothies, or liquid diets to maintain strength. In some cases, patients receive nutrition through a feeding tube, especially when swallowing becomes too difficult. After some time, when they going through or when they start radiotherapy, the side effects of radiotherapy basically they comes in the form of sore throat. So there is no option to feed by a tube, rinse tube, especially when swelling becomes very difficult. Maintaining hydration and calories is a constant challenge but essential for the healing and energy. So Physical activity also affects. Cancer treatment often brings severe tiredness known as cancer related fatigue. Patients may feel exhausted even after sleeping. Gentle exercises like walking or stretching can help, but rest remains vital. Balancing activities and rest become a daily decision. Doing enough to stay mobile, but not so much that it drains all the energy. Dealing with the side effect is also a very big problem during the treatment. The soreness or stiffness in the neck and in the jaw, skin irritation, and in the radiation areas, difficulty swallowing or speaking, weight loss or loss of appetite due to treatment as the side effect of the treatment, nausea and vomiting, very common during the chemotherapy. So managing these symptoms become part of daily life. They every day they have a battle. They're struggling with these things. Doctors and nurses teach coping strategies like using a special kind of mouthwash, mouth rinse, moisturizing radiation burns, or learning swallowing exercises with a speech therapist. Emotional adjustment during treatment is also a very important part. Emotionally, treatment can feel overwhelming. The uncertainty about outcomes, the physical changes, and the constant hospital environment can lead to the anxiety or fear of recurrence or fear of a lot of things. I'm not going in that because I'm talking here about or discussing about the um, head and neck cancer and how to cope up from this that um, duration of treatment and after that also. So I'm not going to say anything or discuss anything, or and I'm not going to use any word which creates lose hope, whoever listening as a patient or their caregiver kind of things. So this is very important. So many patients describe their feeling that they have lost control in their lives. Support from the family, friend, and counselors play a very vital role. Group therapy and meeting with patients going through similar experiences can provide comfort and hope. For some, spiritual or religious support becomes an anchor during these difficulty days. The fear and anxiety, which the cancer is actually people when they listen this term cancer, so the first emotion came in their heart, in their mind is fear. The fear of cancer itself and the fear of recurrence often dominates patients thoughts. During treatment there is anxiety about side effects and whether treatment will work or not. After treatment ends, a different kind of worry appears. What if it comes back? Regular follow-up visits can trigger stress. Every scan or checkup might bring back memories of diagnosis, creating what is often called sad anxiety. Depression is common among patients with head and neck cancer. Physical pain, disfigurement, speech loss, or social isolation can make people feel hopeless or withdrawn. When patient lose the ability to eat normally or speak clearly, they sometimes feel a loss of identity. Counseling, antidepressant, or support group can help manage these feelings. It's important that survivors know that emotional recovery takes time, just like physical healing. Um, Body image also affect due to the treatment. Surgery or radiation may leave visible scars, swelling, or changes in appearance. Losing a part of the jaw, tongue, or throat can be traumatic. Patients may avoid mirrors, feel embarrassed, or fear rejection. These changes affect self confidence, very important. Fear of recurrence, fear of that when they are not able to face themselves, even. So, that is also very challenging part. And after treatment ends, the patients often expect to feel relieved, but many experiences a mix of gratitude and lingering fears. The transition from frequent hospital visits to occasional checkups can make them feel suddenly alone. Survivors may also face survivor's guilt, especially if they lost friends to cancer. Learning to live again with awareness of mortality but also gratitude for survival is a gradual process. Um, Changes in family dynamics also. This cancer changes everything. Cancer affects not just the patient but the whole family. During the treatment, the spouse, children, and parents often take caregivers' roles. They can strengthen relationships, but it can also cause stress and fatigue for caregivers also. The treatment, the duration of the treatment, and after that, cancer not affects the patient, it affects the whole family, everyone who love them, whoever living with them. So it impacts a lot in their life and lifestyle. Some patients withdraw socially because they feel self-conscious about how they look or speak. Eating out, attending gatherings, or even talking in public can become stressful. Friends who don't understand the illness might drift away, leaving survivors feeling isolated. On the other hand, many survivors discovers deeper, more meaningful friendships. People who stand by them through illness become lifelong companions. Support groups also create a sense of belonging and mutual understanding. Work and financial challenges also a big plays a also very big role during the whole journey. Treatment can force people to stop working temporarily or permanently. Loss of income combined with medical cost can cause financial strain. Some may face discrimination or lack of understanding at work due to speech difficulties or visible scars. Rehabilitation programs that help survivors re enter the workforce, along with social welfare support, can make a big difference. Employers who show compassion and flexibility can help people rebuild their confidence and livelihood. Physical and functional challenges plays also very important role during the treatment and after the treatment of head and neck cancer in patients and survivors. Head and neck cancer treatment often affect the vocal cords, tongue, jaw. This can lead to the hoarseness or slurred speech or even loss of voice sometimes in some cases. Speech therapy helps patients relearn how to communicate, sometimes with new technologies or devices. The inability to express oneself clearly can lead to frustration or embarrassment, especially in public or professional setting. Family members learning to be patient and understanding during the adjustment phase is very crucial. After surgery or radiation, swallowing can also be very painful or difficult. Some patients choke easily, others can't swallow solid food. These all things impact not only nutrition but also social enjoyment also. Sharing meals is a core part of human connection. So the journey is actually very painful, and a lot of things like cancer fatigue can last for months or even years after the treatment. It's not just being tired, it's a deep exhaustion, and that rest alone doesn't fix. Patients need to pace themselves, take break, and slowly rebuild stamina through gentle physical activity. Nerve damage from surgery or radiation can cause pain, numbness, or tingling sensation. Chronic pain management through medication, physiotherapy, and relaxation techniques become the part of everyday's life. Sorry. Radiation often damages salivary glands, causing dry mouth. This makes eating, speaking, or even sleeping uncomfortable. Patients often carry water constantly and use special mouth gels. Taste can make favorite foods unpleasant or bland. Eating becomes more about function than enjoyment, which can affect mood and social behavior both. Some patients need a tracheostomy. It's a kind of a special surgical opening in the neck to help them to breathe. This can be temporary or permanent. Adjusting to breathing and speaking through this tube requires training, patience, and emotional resilience. And in long term, treatment effect ends with the survivor may face lingering side effects like stiffness, swelling problems, or nerve pain, like whatever we discussed recent just now. Regular follow up and rehabilitation help manage these issues, but they remind survivors daily of their cancer journey. Very painful in pieces. So, how can we plan the coping strategies and recovery? It's very important, or you can say that rebuilding the life. So, support system is very plays very important role in this rebuilding life after cancer. Recovery doesn't happen alone. Family, friends, medical teams, and support groups all form a network that helps survivors regain stability. Meeting others who have walked the same path provides encouragement and reducing feeling of isolation. Rehabilitation is holistic, not just medical. It includes speech therapy, nutrition, counseling, psychological supports, and sometimes physical therapy also to restore movement and strength. Patients learn to adapt, finding new ways to eat, communicate, and express themselves. Small victories like being able to eat favorite food again and speak clearly bring immense joy and confidence in them. Emotional healing often takes longer than physical recovery. Many survivors describe their journey as a process of rediscovery, learning who they are after cancer. Acceptance doesn't mean forgetting the pain, but rather finding meaning in it. Some becomes advocate or volunteers, sharing their stories to help others. This sense of purpose helps them um, turn suffering into strength. Healthy lifestyle changes after surviving head and neck cancer. Many people quitting smoking, reducing alcohol, eating healthier, and exercising regularly. They understand more deeply the value of life and health. Preventing recurrence become a personal mission, and survivors often inspires others around them to adopt their healthy habits. The road through head and neck cancer is filled with challenges, the physical, emotional, and social, but is also a story of courage, adaptation, and resilience. Each survivor carries scars, but also strength. While medical treatment fight the disease, love, understanding, and hope heal the spirit, the journey teaches patients, the families, the importance of empathy, patience, and living each day life fully. Survivorship doesn't mean returning to life as it was before. It means creating new normal or shaped by gratitude and determination. Head and neck cancer changes life in profound way, but it doesn't define them. With timely treatment, rehabilitation, and emotional support, patients can regain their confidence, relationship, and joy in life. What truly matters is not just surviving cancer, but learning to live well after it, embracing each day with strength, self acceptance, and hope. This is very important. So, this whole journey from detection of cancer to treatment and then positively, um just winning after winning the battle of this cancer, this whole journey is very painful but very it changed the life of patient. And so it's very important to know about that, to aware about that, the battle of every cancer survivor, whoever uh, battling with the disease and winning from that disease. So my talk is just about the um, awareness, uh, about the journey during the cancer treatment, after detection of treatment, after detection of the disease, and how the patient live. Tomorrow I will be online at 9 to 9:30, and tomorrow I'll tell you the treatment, the rehabilitation part in detail, um, uh, after winning this battle as well as during this battle. So, especially, there are two parts of rehabilitation: during the treatment and after the treatment. So, we will meet tomorrow at 9 o'clock at the same time, and we will discuss. And anyone who have question or queries, kindly send those queries on my channel, please, and I will answer you for sure. Thank you.